Click subscribe and bell icon to get regular notifications.
Hi, I'm Dr. Venkata Ramakrishna, consultant spine surgeon, Yashoda Hospital, Malakpet. The most common spinal problem is the lower back pain, which can be acute and chronic. The acute causes are because of the injury or any muscle spasm. However, the chronic back problem is a real burden to the society, and it's causing real decrease in the activity of daily life for all the young population as well. The main cause is because of the mechanical problem, which is due to the odd working postures and the long duration of the constant sitting posture and not having a proper exercises. Having said, in the early elderly generation, that is because of the degeneration, that is due to wear and tear of all the spinal joints and the intervertebral discs. So in young population, previously, we never used to see this kind of pain because they used to have a proper exercises before in olden days. Now that demand of the work, the people have to have the constant sitting posture, which will cause the chronic low back pain. And the causes, apart from the normal degeneration, which is the most common, are infection, tumors, trauma are to be ruled out depending on the type of etiology. The trauma is nothing but injury. Because of the injury, the patient will have the back pain. There may be the soft tissue injury or the bony injury as such. In tumors, it is seen mostly in the elderly population where it is called as cancer. The most common is metastasis, and it can be from the other organs which is spread to the spine, and the primary as well. Primary tumor is from the spine vertebra as such. The spinal primary tumor is from the vertebra as such. It is developed within the spine, which is not spread, and the most common of the spinal tumor is multiple myeloma. Since we have already discussed, the most common cause for the back pain is the mechanical type and the degenerative type. Usually we tend to get this kind of back pain because of the long working hours. It's not only the long working hours, but the type of ergonomics which a person sits or performs during his work. The position of the spine during his work is really important. Sitting for long duration without a break is definitely a bad thing for the spine. So it definitely affects the spine, and the patient will have the early degeneration signs in the disc. The early degeneration is nothing but the disc is made up of a jelly-like material which is really flexible. There is no blood supply to the disc, so the only nutrient exchange is through diffusion. That will happen only when there is a proper movement at the disc base. When the patient is sitting constantly at certain position and working, especially in a white collar job like software engineers or any other unaccustomed works, so they'll have the loss of diffusion to the disc base, and that will cause early degeneration because of the constant pressure on the disc as such. By taking regular breaks at frequent interval of time, like every half an hour a person can take a break, which will help improve the nutrient exchange to the disc and prevent the early degeneration to the disc, which is one of the cause for the chronic back pain. Most of the patients coming to OPD, almost 80 to 90%, they have the problem of the back pain, which is usually mechanical. And sometimes 30 to 40% of the back pains will subside by itself. And whenever the back pain is persistent, which is for more than 2 weeks or 3 weeks, and when the patient is having back pain along with the radiation of the pain to one of the legs or both the limbs, then that's the time when the patient has to consult a doctor.